You've seen the headlines, right? These new weight loss drugs are everywhere. They're being called a massive medical breakthrough. But what if the very thing that makes them work so well also creates a hidden risk for one of the most common and most critical cancer screenings we have? Well, that is the unexpected connection we are diving into right now.
So you have these incredibly popular new drugs on one side, and this really important medical screening on the other. How in the world did they connect? And more importantly, why should you care? Let's start with the drugs themselves.
All right, first things first. Let's talk about the drugs that have been making waves all over the world.
You've probably heard their names: Ozempic, Wegovy, that whole family. They belong to a class of drugs called GLP-1 receptor agonists, or GLP-1RAs for short. Now, one of the main ways they work is by slowing down how quickly your stomach empties. That helps you feel full longer. And that little detail, that's the key to this whole story today.
Okay, so now let's flip the script and talk about the other major player here, a routine procedure that relies on one thing more than anything else: a crystal clear view.
Yeah, we're talking about the colonoscopy. And before a doctor can even start, the patient has to do something called bowel preparation. And, it's pretty much exactly what it sounds like. It's a process to completely clean out the colon, so the doctor gets a totally clear, unobstructed view of what's going on in there.
And this slide just breaks it down perfectly. If the prep is good, the doctor can see everything. They can spot polyps or other potential problems. But if that prep is bad or inadequate, well, the view is blocked. That can mean they missed something important, or you might have to do the entire thing all over again. And literally, nobody wants that.
So here's where it all clicks into place. Remember how we said these drugs slow down your digestion? Well, doctors started to wonder, could that same effect be messing with the bowel prep process, which, is all about clearing everything out on a really tight schedule?
To get a real answer to that question, we've got to look at the science. And in this case, we're looking at a major study that was published in the American Journal of Gastrology.
This quote right here tells you exactly where things stood before this big study came out. It was a complete unknown. Doctors had a hunch something was up, but the actual connection was, in the journal's own words, unclear. So researchers decided it was time to get a definitive answer.
And they did it using this incredibly powerful tool called a meta-analysis. So instead of just doing one new study, they went out and gathered up the data from a bunch of previous studies and then combined it all. It's like, instead of one small photo, you're creating this giant high-resolution mosaic. It makes the final result way, way more reliable.
And just how big was this data pool? It was massive. The researchers pulled together data from 5 different studies, which included a grand total of 10,833 patients. So yeah, this isn't just a small observation, it's a huge investigation.
Okay, so you've got data from over 10,000 people. What did the scientists actually find when they started crunching the numbers? Let's break it down.
The method was actually pretty straightforward. They split all those patients into 2 simple groups. You had the people taking GLP-1RA drugs, and then you had a control group of people who weren't. Then, they just compared the results of their bowel preps.
And boom, this is the main takeaway, right here in this chart. This shows the rate of inadequate bowel prep for both groups. Just look at that difference. The bar for the folks on GLP-1RAs is so much higher than the control group. The picture alone tells a pretty powerful story.
And here's the headline number. The study found that patients using these drugs were 2.1 times more likely to have an inadequate bowel prep. Let me put that another way. Their risk of having a failed or incomplete procedure more than doubled. That is not a small difference. It is a clear, statistically significant link.
But the researchers didn't just stop there. They also looked at a second measurement, something called the Boston Bowel Preparation Scale. Think of it like a grading system for how clean the colon is. Higher scores are better, and a lower score means the doctor's view was worse.
And yep, this data totally confirmed the first finding. On average, the GLP-1RA users had a consistently lower score on this cleanliness scale. So it wasn't just that more of them had bad preps, the overall quality of the prep was just measurably worse for that whole group.
Okay, we've looked at the drugs, the procedure, the data. So what does all of this actually mean for you? This is probably the most important part of this whole explainer.
Let's just go straight to the source. The study's own conclusion is direct, it's unambiguous. Their huge analysis suggests a very clear link. Using these medications increases your risk of a failed bowel prep.
So what do you do with this information? Well, it all boils down to 3 simple but really vital steps. First, always tell your doctor about every single medication you're taking. Second, if you're on one of these GLP-1RA drugs, mention it by name. And third, whatever prep instructions your doctor gives you, follow them to the absolute letter. They might even have a modified plan just for you because of this.
And this right here is the bottom line. This research is not a reason to panic, and it's not a reason to stop taking a medication that's really helping you. It's all about communication. The goal is just to make sure your healthcare team has the complete picture so they can make the best plan for a safe and effective procedure for you.
It's just a powerful reminder that in medicine, everything is connected. As these revolutionary drugs become part of daily life for millions and millions more people, it kind of makes you wonder, what other unexpected interactions or effects are we going to discover down the road? It really just goes to show you that the work of medical science is never, ever done.